It's a real problem when you say we've got more nurses and you go, not next to me when I'm on the ward.
That's what I'm admitting.
Or the economy's doing better, not in my household.
No, that's right. And so I get that. I really understand
It's an okay
that.
pushback.
I've got to try and solve initially from where we were, where we're losing 14% of our nurses every year out of the New Zealand healthcare system, to a place now where we're losing 8%, which is about sort of what normal attrition would be. I've got to do everything I can to put the money in at a system level, but I agree with you completely. You know, we have big gaps of support in key parts of our healthcare system, and we've actually got the money going and we've got the people being hired, but they're not being deployed in the right places, or there's more work to do to get them perfectly deployed into the right places. So
who fixes that?
Well, so for example, you know, we know we've got a challenge in provincial and rural health in New Zealand, right? It's really hard because you get efficiencies in a big city and you can end up with postcode lottery as a result.
Yeah,
so
which is what we have got.
Yep, and so what we've done is said, like, if you're a GP in a regional New Zealand area, we will give you $20,000 to go off and actually hire that extra nurse that you might need. We're trying to put 450 more nurse places into what's called nurse practitioner or nurse prescriber training to build out the system that we're going to need for the future. But you're also changing the wheel while you're driving, and there are shortages in key places across New Zealand as every day, and that is the reality of the system right now. And that's why I keep coming back to, you can put the money in, you can put the people in, but if you've got a massive bureaucracy that actually then isn't focused on getting that through the bureaucracy out to the front line to support our doctors and nurses who are doing a kick-ass job, that's what we've got to work on.
So one of the things he obviously banged on about, like he's constantly banging on about, is money to the front line, getting out of the back room, money to the front line. So Bomber, you've already said the number, 4,000 nurses short. This was as this government was coming in, grown to 4,800 short. So putting 2,100 in sounds great. We need another 2,700 on top of
Right.
that. We have 100 litres of water going into our spa pool. There is a lot more to go. And what this government's doing, and obviously we're lucky enough to be connected to people in the industry now doing podcasts on this network, is that they say, no, there's no hiring freeze. There's no hiring freeze. And what's happening is in a hospital where there might be 30 or 40 vacancies, they're allowed to hire one or two. So in other words, they can say, we're hiring people every week. Yeah, but not to the standard or the level that we require.
And the other thing that's really important to understand in all of this is that a lot of that extra money that they keep claiming and keep pointing to pouring in, that's not going to public health. It's going to private health companies, for-profit companies. They are stepping in and they are getting more of the public health purse pushed their way in really cushy deals. And this is part of a privatization agenda aimed at public health that we're having in public education, that we're having on our roads with mass surveillance networks now. This is an ongoing privatization agenda, and it's not explained that way because the ideological framework is considered too complex by news producers in the mainstream. So it's never explained actually that this is part of a privatization agenda, right? Yeah. It just is.
And unfortunately, I mean, like, with all due respect, I would welcome him on email this week again to Simeon Brown. Love to come on and talk about the nurses. No reply. No reply. Here's some more information being out there. So the back room front line, out of the back room into the front line. This is from the NZNO. Recruitment has now been paused on all hospital roles that are not patient facing. So these are the back room officers, and all public health roles that are not community facing as part of the cost cutting. Health New Zealand Te Whatu Ora says new measures will not impact frontline services. New Zealand Nursing Organisation Chief Executive Paul Golter says it appears that little consultation has been done on this change and what it means for frontline staff such as nurses. Health New Zealand Te Whatu Ora should have spoken to unions before going ahead with this move. It is inevitable that this recruitment freeze will impact frontline services. It will lead to understaffing in support roles such as admin, IT, support, laboratory testing, data collection that will directly affect frontline staff. These roles are the ones that support frontline workers to do their jobs well. Health is a system that needs both frontline and non-patient or community-facing roles to work well. And I don't think it could be said any better. I've always used the example, could you imagine your primary school with no caretaker? How would that fall over in the space of just a day or two? This one from RNZ goes on to talk about the freezing roles that we've just said, one very quickly. A nurse at the Southern DHB told RNZ a role in their department had been empty for about 10 weeks after a colleague left, even though a manager requested they be replaced almost immediately. Normally approval would take about a week, 2 at the most. She wanted Te Whatu Ora to be honest about what was happening. An internal Te Whatu Ora recruiter who asked not to be named said many of her colleagues had been in tears as they spoke to angry clinical managers, wondering why nothing was happening about roles that needed to be filled. The managers had been initially told the freeze did not apply to clinical roles, but recruiters had been told to pause everything.
Of course.
Everything.
Of course.